May is Stroke Awareness Month, and today we're talking about the risk factors, signs of a stroke, and what steps to take if you identify those signs. Stroke nurse practitioner Niah Gilmore with UofL Health is with us here today to fill us in on this. I know this is your specialty, so you're the perfect person to have on today.
Yes.
Let's start first with some of the common risk factors for a stroke that you see in your work.
Well, first of all, thank you for having me. Thank you so much. I think it's important to kind of note that when we talk about stroke risk factors, we kind of categorize it into two different categories. You know, certain things that we can change, like high blood pressure, high cholesterol, diabetes, smoking tobacco. And then there are certain risk factors that we can't change. Of course, that being age. Patients that are greater than 65 have an increased risk. Women have an increased risk, and there are some minority populations that have an increased risk of stroke, that being African Americans and Hispanics. They have an increased risk of not only stroke, but also having higher rates of mortality and morbidity when it comes to stroke.
So we definitely want to make sure people know those, and then knows the signs and symptoms to look for if someone's having a stroke. So let's run through those. Absolutely.
So at UofL Health, we like to use something called BFAST. That's our acronym. And so the B stands for balance and coordination. The E stands for eyes. If you notice that your eyes may be deviated to one side, or you may have double vision, blurry vision. The F stands for facial droop, facial asymmetry. The A stands for arm weakness or leg weakness on one side. The S for speech difficulties, and then the T, of course, is time, because we always say time is brain. As soon as you notice those symptoms, it's very important that you get to the hospital.
And are these things that you would notice on yourself or someone else?
Both. Sometimes if you were to wake up and you notice that one side of your body, it's hard for you to move one side of your body, or you look in a mirror and you notice that one side of your face is drooping, or somebody that's talking to you and they notice that your speech is slurred and it just doesn't sound right. Those are, you know, sometimes you notice them yourself. Sometimes I've had patients that their family noticed something just wasn't right and need to get to the hospital.
Okay, so what do you do? Is it a call 911 situation?
Absolutely. Call 911 as quick as you can.
Okay.
We have medicines that we can give, clot busting drugs that we can give for stroke. If you have one of those, if you have an occlusion in one of those large vessels in your blood, in your brain, we have interventions that we can do. We can actually go in and retrieve those clots. So that's why we always say it's important to get to the emergency room as soon as possible.
Okay, that's that T, right? Time is everything.
Time is brain.
Time is brain.
Time
Okay,
is brain.
I like that. Well,
Yes.
Thank you so much for coming on today.
Thank you for having me.
Making sure we know this, because I know this is incredibly important.
It is very important. And you know, I kind of challenge some of my viewers out there that if you haven't, make sure you go out there, get a primary healthcare provider, and at least go get your labs checked. See what your cholesterol is. See how your blood pressure is doing, and just know that if you have some of those risk factors, let's get out there. Let's get active. Let's change the way we eat.
Okay, I love it. Something great to take home with us.
Absolutely.
Thank you very much.
Thank you.